we will be recording the session today. This is part of the HIV R4P Advocates Network. So let me just, everybody, we're really excited to have this conversation today and to welcome everybody into this space. So we're going to have a conversation about the Dapivirine ring and the new WHO guidelines on it and what this could mean. So we're going to be recording this session and we will be posting it in the Advocates Corner space on the HIV R4P platform for those who are registered for the conference, but then it will also be on Engage later on. So places to find it. And so just as a sort of an opening session, I'm really curious to know what brought everybody into this space. So I want to make sure that we all feel comfortable raising our voices, raising our questions here today. And so we will do my favorite activity, which is a little Zoom storm. So everybody, I just want you to write in the chat, don't hit enter, write in the chat. Why it is that you are interested in the Dapivirine ring. What brought you to the session today? So again, we're writing into the chat, what brought you into the session today? Don't hit enter. We're all going to hit enter at the same time. So what brought you into this space today? It could be a question. It could be a purpose. What brought you into this space today? I'm looking at faces to see who's typing. Okay, so on the count of 3, we are all going to hit enter. Okay. 1, 2, 3. Okay, I see some. Okay, more people are going to be writing in. Remember, you can hit enter. What is it that brought you into this space today? It's a new thing. Okay, great. We love learning new products in the pipeline. Thank you, Mitchell. Flattery will get you everywhere, even though I'm not a panelist. I'll say it for them. Great, so we're saying what brought us into this space today? What brought us into this room? Excited to hear more about implementation. So some focused on sort of learning something new, a new prevention option, a new tool in the pipeline. Others thinking about how do we actually use this information. We are going to talk about all of that in this space today. Okay. Rare to find, great. So I'm glad we seem to have a variety of country perspectives here. Be able to talk a little bit about what it looks like. Maybe that's another just thing that we could all write into the chat feature, and Manju, I'll kind of kick it over to you. As everybody introduces themselves, just say where you're from. We know why you're here, but just what part of the world you're from, maybe what part of the sort of HIV pipeline are you an advocate? Are you an implementer? Do you work in the regulatory space? What hat are you wearing today?
Well, as people are writing in, I'm very excited that we have such a great turnout today, and I'm sure we'll have more joining us. So please do write your name, introduce where you're from. My name is Manju Chathani Gada, and I'm an advocate. I work with AVAC, And the Dapivirine ring is a tool that many of us working for women's, increasing options for women in HIV prevention have been following for a long time, have done a lot of advocacy around, have followed the trials. And so this is very exciting moment as the Dapivirine ring moves out one more step on its journey into the hands of cisgender women who want to use it. So I am excited to have a great panel here. This is a very informal conversation, just like we've been having in all our other sessions. I'll give you a tiny bit of a background, and then I will ask the panelists to just very quickly introduce themselves. So as many of you may know, on January 26th, there was a web story from the WHO where it recommended the Dapivirine ring, the Dapivirine vaginal ring, as an additional prevention tool for cisgender women. This follows the WHO November 30th announcement of pre-qualification, which means that the drug was assessed as safe, efficacious, met manufacturing quality controls to go forward. And it follows up in July, where the European Medicines Agency gave it a positive scientific opinion, and that's what took it out of the gate and towards its regulatory pathway. So today we have Michelle Rudolph from WHO to talk to us about that guidance. We have Sinazo Pato from IPM to tell us a little bit about the critical next steps that IPM will be looking at, and also how IPM are working with advocates. And we have Shakira Namwanje from UNASO, a young advocate who has been working with young women, helping them understand new prevention options, and in particular, the Dapivirine ring. So we have a great group here. So I'm going to first start with Michelle. Michelle, welcome. Thank you for joining us. Thank you for being an advocate for prevention options for women. So why don't you tell us a little bit about this WHO guidance, what it is, what it isn't, what it covers, and what was in the guidance. Thank you.
Sure. First, thank you all for being here. There's one of the participants, his name is Yanis Mamaletis in the audience. I just want to call him out. He used to work with us at WHO and was really key in a lot of the preparatory work we did with the Dapivirine vaginal ring, in particular the early days of looking at the EMA opinion. So Yanis, always good to see you. I miss working with you. Okay, so the World Health Organization. Manju, thanks for the introduction. So yes, I'm Michelle Rudolph. I work at the World Health Organization in Geneva, Switzerland. I work on the HIV prevention team, and under my portfolio comes future prevention products. So Manju gave a great introduction of some of the background with the WHO recommendations. So Manju, I didn't take notes about what you asked me to talk on, what it is, what it isn't. So let me tell you what it is, and I invite questions and I invite clarification from Manju if I miss something she'd like me to cover. So what it is, WHO is a normative body. We issue recommendations that frequently ministries of health take up and incorporate into their own national strategic plans, national guidance. So a group met in September. It's called the Guideline Development Group. And what we posed to them was a question on should the Dapivirine vaginal ring be included as a WHO recommendation for HIV prevention. Just to summarize, the group agreed, yes, it should. However, to be really specific, the recommendation is worded, the Dapivirine vaginal ring may be offered as an additional prevention choice for women at substantial risk of HIV infection as part of combination prevention approaches. So I want to emphasize a few terms in that phrase. May be offered. This is a conditional recommendation. It is still a recommendation, but we don't have real life experience implementing the ring. There's still unknowns, and there are a lot of people trying to answer those unknowns. For women at substantial risk, WHO defines substantial risk of HIV infection as settings where HIV incidence is greater than 3 per 100 person years. This is how WHO defines it. Other Geographical settings, other countries, other areas may define substantial risk as 2 per 100 person years. This is a suggestion from WHO. And may be offered as part of combination prevention approaches. WHO is really strong in saying HIV prevention should not live in a silo. It's about choice. It's about having prevention choices. And one prevention choice might not be right for one person, but it's right for another. So we're very clear in saying that this oral PrEP with the Dapivirine ring should never be offered alone. They should be offered along with a menu of choices. So Manju's already gone through what I was going to say about the EMA, about pre-qualification. And I'm just going to kind of go through a couple points and not take up too much time. What I wanted to say was that the guideline development group looked at this recommendation and said we still have some implementation issues and research gaps to address. And these implementation issues include understanding safety for resistance, acceptability, ensuring that women have appropriate support, ensuring that choice is available, informed choice, that women know they have the choice of having Dapivirine ring, oral PrEP, or other options. Demand creation will be really important. This is a new product, so both providers and the community of women, cisgender women, as this is targeted for, many of them won't know about it. So it's going to be really important for national governments, advocates, communities to start generating demand for this product. And also what's going to be really important is training and support for providers. Vaginal products are not, in sub-Saharan Africa specifically, there are no other vaginal HIV prevention products on the market. So we as a community are going to need to look at how to speak to providers, to understand what providers need in order to offer this product, what are their questions, what are their gaps. And in terms of research gaps, we're looking at more information about safety in pregnancy and breastfeeding, but we don't have that absolute data yet. We also need more information on the effectiveness among women under age 21. It can be assumed that we don't have strong data on effectiveness of women under age 21 because adherence was low. However, we still need to understand this in more detail. So I'm going to stop there. If there's questions or clarifications, please let me know what I should speak to. Thank you.
Thanks, Michelle. That was a really good overview, and I'm sure there'll be a number of questions. I'm actually going to hand over to Sinazo now. And as Sinazo is coming off, also just recognize that a number of people from IPM are also here, and you're very welcome. So Sinazo, tell us a little bit about yourself, but also tell us from your perspective and IPM's perspective, why is this guidance important? And what does it do? What happens next now in terms of regulatory approval in different countries for the Dapivirine ring?
Hi, Manju, and thanks for inviting me. Oops, I think I'm on mute. No, I'm not. Thanks for inviting me. And I am based in South Africa, and I'm the senior outreach specialist. I work mostly with programs related or involving adolescent girls and young women. I do a lot of community engagement and advocacy work for the Dapivirine ring. So just to pick up on Michelle's talk, which was great. What is critical, what we're doing now, there are quite a number of projects or programs or activities that you are busy with as IPM to prepare for the ring. For an example, Michelle mentioned that there's still data needed to be answered on other women. So just to mention that there are monthly Dapivirine research studies that are currently underway to address such gaps on acceptability of ring among pregnant women, breastfeeding women, and adolescent girls between ages of 16 to 24. So those are currently underway, and most of them were started 2018, 2019, and 2020. So in the next coming months or years, we will have data to address such gaps. There are also other things that are happening. Yes, the Dapivirine ring has reached a milestone in terms of EMA's approval or WHO's recommendations. However, IPM is still in a process of submitting a dossier to country-specific regulatory authorities. This is done in a coordinated manner. So EMA's and WHO's recommendations nod will really help, to fast track this process, because women have been waiting for the ring. Women want the ring. So that is underway. But there are other aspects that are needed that are currently underway. For an example, IPM is collaborating with expert organizations, to look at issues such as supply chain, issues such as market research, demand creation, healthcare providers training, new material, labeling of the products. So IPM is not working in isolation. We are collaborating with expert organizations to look into those needs. Where I work, my primary work is to looking into community engagement and strengthening advocacy work. So over the years, I mean IPM and other collaborating partners, we've been focusing on in communities where ring clinical trials were conducted. Now we're expanding community engagement to include communities that needs the ring most, or even countries that were not part of the clinical trials. Clinical trials took place in South Africa, in Zimbabwe, in Malawi, and Uganda. Now we're expanding to Kenya and Zambia and Tanzania. So, which is great. So we looking for or working with, collaborating with community-based organizations to ensure that communities are prepared so that by the time ring is approved or roll out, communities are aware and the end users are aware and are willing to uptake the use of the ring. But also advocacy. I mean, there are a whole lot of issues that I mentioned, regulatory process, government policies. This is where we need advocacy more to monitor and keep track of all these approval to see if there's progress. Is the progress going slow? Is it going fast enough? Government including rings in their HIV prevention policies? If not, when and how? Healthcare workers ready to be trained and ready to insect the ring once it's available. Are communities ready? Are communities prepared? Are they aware? Is there enough information out there about the ring? So advocacy work is more critical now, even more. Yeah, I'll end there.
Thanks so much, Sinazo. That was a nice overview of all the different elements that are critical now as we move forward. So Shakira, I'm gonna turn to you. There you are. To introduce yourself, why this guidance, you've been following it really carefully, what this guidance means now. And also you get to ask the first questions you have to Michelle or Sinazo and get us going. And I see a few more questions coming in the chat. This is great, please keep them coming. But Shakira, you get to ask the first questions. Shakira?
Hi everyone. Nice to see you, Sinazo, virtually, and Manju and everybody. So my name is Shakira Namwanje. I am an EVAC alumni fellow 2019, and I currently work as the head of HIV prevention and research advocacy at the Uganda Network of AIDS Service Organizations, which is UNASO. And personally, I am very passionate about the ring, and it's mainly because it is a step or a key or an answer that we've been asking for a very, very long time. And women are eager, young women are eager to use it, to try it out and find out, you know, if it is for them or not, but they are really eager to have this tool in their pocket or in their purses or in their bodies, as I should say. So I think for me, my main point is we have moved, like research is moving at a faster rate than I think we are doing our advocacy, because we have this tool that, you know, research has given us the answer that it helps prevent HIV infection among women. And I feel like we are moving, yes, but we need to move at a faster rate than we are in order to get this to women that actually need it. If I remember, there's a time when President Obama was asked about human rights in terms of key populations, and he said, if the world is moving, we have to be prepared to accept and move as faster, broaden our imaginations in order to accept other people the way they are. So if we are to move together with research, I believe as implementers and as advocates, as policymakers, we need to come up with ways to get these tools faster, because we have the ring, we have so many things that are coming in, and we cannot just lag behind while, you know, people continue to get infected. And I feel like there should be no excuse. We should move faster. We should learn from our past mistakes. We should learn from the things that we've been doing over the years in order to fasten the access to these improved and new interventions to people that actually need them. So maybe my first question would be to IPM, to SIDAZO, would be, now that we have the qualifications from WHO, what is the next step for IPM? Like, what advice or what advice are you giving an advocate like me in Uganda? What should be my emphasis in terms of advocacy to see to it that we are moving forward and a little bit faster than we are, I guess?
Okay. Thanks, Shakira. So the advice that I would give you is to, one, monitor the regulatory submission. Remember, I mentioned that WHO and EMA provided recommendations, not approval, yet we still need to submit to countries' regulatory authorities and get approval. And then in collaboration, parallel, I think the process would be, once we receive approval, is to sensitize, you know, your policymakers, country policymakers, your decision makers in your country, so that they are aware, because you realize that most stakeholders don't know per se about the ring, is to really sensitize, educate them that this is a product that has undergone these stages and is almost, you know, ready to be approved. Look into their HIV prevention strategy and work with them to make sure that the ring is included in their HIV prevention policies. That'd be one. But also on the ground, it's important that you mobilize your stakeholders on the ground. Again, offer, because you are well knowledgeable about the ring, offer education about the ring. What is the ring? How does it work? Who is it for? And when is it expected? Just to prepare them for the ring introduction. We've learned from other HIV prevention tools that while we busy with regulatory, we need to make sure that we prepare our communities so that uptake can be at maximum point as possible. So there are layers and layers of steps that you could participate in.
Yes, Maybe the other question would be, our countries seem to put emphasis on products that have maybe funding or have like a donor that is looking to input funding for that particular intervention. Governments or policymakers, we've seen them respond much better or faster when that particular tool has, let's say, funding or is promised funding. What is the process, or how far are we with the funding for the ring? Is it going to be, how are we going to get it to the people? Maybe that's my question in terms of funding. Do we have a plan? Or
one other aspect that I did not mention in the whole lot of activities that are currently happening at IPM is donor support, seeking for donor support so that we support the countries such as Uganda. But ultimately, the ring will have to be included in national strategic plans so that it can be donor funded. However, yes, there is also a donor funding drive that is happening at the moment.
Maybe this is a good moment to also ask Emily to talk a little bit about the PEPFAR COPS and the prioritization of Dapivirine ring access in that discussion. Emily?
Sure. Hi, everybody. I just fixed my lighting so it wasn't super creepy, but if anyone wants super creepy lighting, I can turn it back on. Hi, it's so nice to see so many of you. Just a quick little survey, and you can drop it in the chat. How many folks are involved in some way in the PEPFAR, the annual PEPFAR country regional planning process? You can just be like, yes, no, kind of, it's in the background. Awesome, kinda, excellent. So one thing, and IPM colleagues know this full well, of course, and many others. One very concrete way that advocacy is starting to shape up right now, and I'm just going to shamelessly plug a webinar, and I'll drop it in the chat tomorrow, that is on it's organized under the auspices of a coalition called PEPFAR Watch that does work with coalitions going into the PEPFAR rooms, which are virtual this year, but where the country plans are set out for the coming year. And tomorrow we're going to be really delving into activist and advocate strategy with our very own Chilufia, who's on this call, walking through a little bit of what I'll say now, and Chilufia, feel free to come off mute. But the PEPFAR's guidance to its country teams this year has encouraged those country teams to build into their budgets planning for policy and guideline development, service provision for service provider training, and other things that would go into building a platform to deliver the ring. So it goes to this question of where resources might come from. And one of the things that we are trying to do, the activists and advocates that work in the PEPFAR space, is to ensure that every country where it's relevant, and IPM would love your guidance on this. Right now, we're working with a list of countries where the trial happened, but every country where it's relevant, that civil society group go into the PEPFAR negotiations asking for a budget line specific to planning whatever is articulated as needed in that country, just as a baseline, and then working with countries to build out a better sense of what those asks might be. So that's one very concrete thing that is happening right now in the space of the activists and advocates who sort of work on getting funders and payers to align with new prevention. And Global Fund and government are also in those rooms. And so we often will build our requests and our advocacy out so that they are also addressing government and saying, hey, can you tell us precisely what you need so that we can also articulate that? And oh, by the way, Global Fund, you have an emergency response mechanism that could be, maybe part of it could be pivoted to do this or that. So it's a very active space, and I'll find the call info and drop it in tomorrow. Drop it in now for the call tomorrow. But just to let you know, that's one space that's sort of emerging in the next kind of 6 to 8 weeks as seeking to get PEPFAR resources planned out for the coming year at the country level. And then of course, there's also often USAID and central funds that come from DC that don't get built into this annual planning cycle where more resources might come from. So that's a lot. Chi-Chi, do you want to say anything? Giannis said, do you have some sense of country level targets? How are those being estimated? So I don't think that there will be ring targets, Giannis, this year, because the countries don't have they haven't done the guideline, they haven't done the provider training, they haven't done all the baseline build out. We are trying, PEPFAR has ambitious oral PrEP targets, and we're really trying to get a message across about how to push for those and have that expansion build the kinds of programs that we've been hearing at R4P will be supportive of choice and of ring use.
Thanks so much, Emily. And please do put the link, because I think that that will be critical for advocates who are really working in this space. So please do put the PEPFAR watch.
And just a big push, if you guys are not connected to your country, the folks that are doing the COP work, you can still get them, like, ask them to carry this in. Ring prevention advocates, we are small-ish but mighty, like ask them to bring this into these rooms that they go into, because amazing things can be won.
Perfect timing that it's happening right now as well, when we have so many advocates thinking about these things and discussing how they want to move forward. So really critical entry. Thanks so much.
No problem,
Emily. And really want to open it up for discussion now. And maybe as people are thinking of their questions, I will head back to Michelle. And Michelle, you said that the guidance from WHO on the Dapivirine ring is conditional. Can you talk to us a little bit about that conditionality? And what are the circumstances for those conditions to change? And if we have other examples that we can think of for a similar situation where there's conditional guidance.
Thanks for asking that. And I think that is not even, I think, it is an important question. And it's been an important question even before the recommendation came out, when we've spoken to different advocates about what is the WHO recommendation? What are the possibilities? So I want to be really clear. And if no one gets it the first time, that's okay, because it's taken me about 10 years to really understand WHO guidance and the different intricacies. What I want to be really clear on, a recommendation is a recommendation. So there's conditional recommendations and strong, but they're both recommendations. And with a WHO recommendation, a country can move forward easily with their own recommendations. So why is this conditional? This is conditional because the recommendation was based on a systematic review of 2 randomized controlled trials. And the randomized control trials did not have high efficacy, and there was only 2 unpublished open label extensions to base this on. We also base this on values and preferences from a number of studies. However, we don't have any real life experience using this product outside of a clinical trial. So we can't go ahead with a strong recommendation when we haven't seen it play out in the real world. We don't have a product on the market yet. You know, we do have, it's on the WHO pre-qualified list of medicines, but it hasn't been approved by any other by any national regulatory agency. So these are some reasons why it's conditional. Now, we have had recommendations in the past, and I'll use oral PrEP as an example. I think it's a very relevant example for this group. When we first recommended oral PrEP, and I believe it was 2012, that was a conditional recommendation to recommend oral PrEP in the context of demonstration projects, also called pilot studies. And then in 2015, 3 years later, when we had more experience from those pilot studies, from some real life examples, in particular in the US, that recommendation was revisited again. The data, there was a new systematic review done, and then we came up with a strong recommendation. And I'm using that example because I think that's something that people are looking to know, like, can't we have a strong recommendation? And I mean, one example to use is many of the pediatric ARVs that are used in many low and middle income countries have conditional recommendations. And those are conditional recommendations because they're based on a small number of data points. So that's just another example to use it. A conditional recommendation is still good.
Thanks, Michelle. Are there some questions? People want to get off mute and ask directly?
Manju?
Yes, Sanazo.
All right, can I just add on the three studies that I mentioned that they are currently underway on pregnant women, breastfeeding women, and adolescent girls and young women. Those studies are assessing or looking at the safety and acceptability of the ring. So earlier on, I only mentioned that we're looking at acceptability, but I just want to add that we're still looking at safety and acceptability.
Thanks, Ananzo. Any questions?
Manju, maybe I can just ask. Yana's raised a question about the effectiveness of Dapivirine ring and just that it might increase over time. I'm wondering maybe if anybody could talk about how they see, and maybe Emily, this is specifically for you, how the Dapivirine ring might be used with oral prep and how we could sort of parse out the effectiveness of just the Dapivirine ring in the context of oral prep in the background, or dual use of oral prep. I'm not sure if my question is clear, so let me know if I need to rephrase.
Jessica, can I jump in here? Are you
Yeah.
saying, I'm hearing the possibility of two different questions. One is, what is the effectiveness of ring versus oral prep? Or are you asking about the effectiveness of ring plus oral prep?
Both. So how do we determine the effectiveness of the ring in the context of oral prep in the background? Because the point that Giannis made is a great one about, Bob Grant's iPrex and then how it rolled out in the real world, but oral prep didn't have anything to, it had condoms to compete with, but it had no other biomedical prevention option. So how do we parse out the effectiveness of the Dapivirine ring in the context of oral prep? And then how do we look at the effectiveness of the Dapivirine ring and oral prep?
You mean using them at the same time?
Yes.
Well, using them at the same time should be near perfect. I mean, and I say that, with a grain of salt, but before I respond, I just see a gentleman named Lovemore has his hand up before I jumped in. So I didn't know if we wanted to, actually, let me just respond quickly because I'll give my bit and then we'll because I see now Yanis is jumping in as well. So there's no reason to believe that there's anything wrong to use the ring and oral prep. My question is, why would you? Because if one person is using oral prep, we know the effectiveness could be as high as 99% if they're using it correctly and regularly. I wouldn't see the need to add another HIV prevention intervention. I think for many women, the allure of the ring can be the discreetness, that there's no daily pill, and some women just can't or don't want to take a daily pill. Excuse me. Let me just hold on a second here. Sorry.
Don't worry. I often say you bring your real life into
these conventions, and then children call and they keep calling. Anyway, so now I think I've answered the question about ring and oral prep at the same time. If I haven't, please ask me to go on. But now ring versus prep, I would say that, we know from the secondary analysis that the ring is highly effective, and I'm guessing from having worked with Yanis where he's going with this is that, yeah, we saw 40% in Bob Grant's early studies, but when it was rolled out in the real world, we saw it was over 90%. Because in the real world, because it was people who were motivated to use it, they were using it. My assumption is with the ring, we could very well see something similar. I think it's a paper that Liz Brown published in November of last year. And I want to say it was looking at around 66 to 70% effectiveness in a secondary analysis. And we could see something even higher in real world. We don't know yet. I'll let the next people go on. I'll hand it over to whoever's going to speak next.
Michelle.
Thank you. We have a few more questions. I'm going to ask Lovemore and Yanis and Shakira to say their questions, and then we'll see which of the presenters are going to take them on. Lovemore?
Okay, thank you, Manju. My question was based on the ring. When it is now on the market, I wanted to know in terms of accessibility and availability, is it going to be affordable for those people, especially when you look at the African community? I think that's the one that is highly affected by HIV and AIDS. So is it going to be affordable for them, or might you have another case of the COVID vaccine where you've got a few people that can access it, but the majority doesn't have, because the main part is to make sure that we reduce it. So is it going to be affordable and accessible? That's my question.
So the ring is going to be accessible, and I guess the question is, where is it going to be accessible? In the clinic settings or pharmacy, or where? So there are plans or rollout plans that will sort of respond to that question, because remember, before you get the ring, or ring can be injected or dispensed to a woman, woman has to be tested to see if they're HIV negative first before ring can be injected, and be taught how to insert the ring at the first instance. Ideally, yes, ring will be accessible in the public clinic or public settings, and maybe pharmacy, you know, those who want to go and access it in the pharmacy. In terms of price, I think that's where advocacy is needed most, so that the ring can be accessible for free, like any other HIV preventions that are currently available. I mean, PrEP is free, but initially it wasn't. But through the pressure of advocates, now it is accessible for free. Condoms are free, female condoms are free. So this is now one of the roles of the advocates, to make sure that it is affordable and it is widely accessible in the clinics, in the public sector, not only in the private sector. It is available for everyone who needs it.
Sorry, I was muted. Thanks so much for that, Sinazo. And before I take more questions, I think, Leonard, you have something to add to that, and also to an earlier question that went to Michelle.
I'm Manju. Yes, thank you. I was just going to add to the question about ring efficacy. You know, that we saw in the phase 3 studies that the efficacy was really modest. However, we also noticed that in the open label studies that were conducted, 2 open label studies, Hope and Dream, we found that adherence to the ring was much higher. In the phase 3 studies, they were around 80%. And in the open label studies, once women knew that the ring was effective, adherence was close to 90%. And in the open label studies, of course, there wasn't a placebo. So by using modeling, they showed that the efficacy of the ring was over 50%. So Yanis, to your point, you know, similarly as we saw in the PrEP Olay studies, the efficacy had increased in the Olays. And then, of course, the sub-analysis of the ring, as Michelle mentioned, obviously the sub-analysis didn't go to the regulators when doing the approvals, or to the WHO when doing the recommendations as well. But we know that the sub-analysis was done. And then also to add on about the ring, the cost of the ring, to what Sinazo explained, in the public sector, like in all the African countries that we're targeting, medication is free. So we're hoping that the ring will be funded by donors, as Emily pointed out, via PEPFAR and other donor mechanisms that IPM is engaging with. In terms of price, there's often a price question. Currently, the price of the ring as it leaves Q Pharma in Sweden, they're the ones who are making it. I saw a question in the chat. It's around $9 a ring. But we know that as we're scaling up ring production, just because of economies of scale, the price could drop in the next phase to around $7 a ring. And then as the scaling up is even more, it could drop as low as $5 a ring. One more point to add, that IPM is working on a 3-monthly ring, a 3-monthly Dapivirine vaginal ring. So once we have the three-monthly ring, in terms of adherence, ease of use, and also price, it will really be more effective cost-wise. Thanks, Manju.
Thanks so much, Leonard. And thank you for being so patient, Yanis and Shakira. Yanis, do you want to go?
Yes, good morning, good afternoon, everybody. I just, really great discussion. Thank you again, Michelle and others. Just on the issue of efficacy, I think because it's very contemporary around our current COVID-19 vaccines, and I think the globe is rightfully obsessed with, efficacy of 95% for Pfizer's Moderna vaccine versus other vaccines that are maybe 50, 60, 70%. So I think kind of people have this interest, right, in knowing the product that, will go into their bodies, what that efficacy effectiveness will be. And I think that we have to be very careful on how we communicate that, and obviously being evidence-based. So I think because there is an area of uncertainty, I would say, around what is the product effectiveness. Is it 50, 60, 70%? And depending on what kind of the consensus is by a guidelines development group at WHO or a US CDC or the kind of the South African either regulator or expert committee in that country making guidelines, I think that has to be relayed carefully to women. And I think maybe also a call for, so I think there's space for well-constructed implementation research that can try to answer some of these questions around effective use as we sort of move even past the open label extension studies. So I think that's kind of where I stand with this, because I think people will genuinely ask, how well does it work? And so we need to just be, kind of very careful on what that, that message is to women. I mean, we know we have this experience also with when we're talking about oral prep. I mean, specifically for women, we say it's up to 90% or over 90% effective. For MSM, we have that number of up to 99%. And so I think we need to be conscious and careful when we put numbers to product effectiveness. And again, as that's related to the people that can benefit from these products, and not just the ring, but I think for all products. I don't know if anybody has some reflections on that, but I think it's still a space, work in progress. I mean, we know it works, and that's why it has like a conditional recommendation by WHO. And we have, 2 independent randomized clinical trials. But I think that maybe Leonard mentioned the word, I think he talked about modest efficacy from the RCTs. And I think that's kind of, we've used that terminology, and we need to be kind of conscious as to how that may affect uptake from women based on the language we use on product effectiveness.
Yanis, thanks so much for that. And it's really important because the conversations that many folks are having are not only about the effectiveness of the ring, but now talking about long-acting injectables, considering how their policymakers will be looking at different effectiveness. So I think this is going to continue to be an issue. Michelle, Sinazo, others, as you are thinking of a reflection, Shakira, you had a question. I want you to go ahead and ask your question while they're thinking on their reflections. Shakira?
Yes, thank you, Manju. I don't know if mine is a question or a statement or something. We have had PrEP for a while now, and you find that in our communities, there are so many people that still do not have the right information when it comes to PrEP. Even healthcare providers who are actually providing PrEP, you find that there's still that information gap. So with WHO giving a conditional recommendation to the ring, maybe that's something I need to really understand. does this mean that the ring can only be given to an individual if they are willing to use another product, or I can use the ring without another product? That's maybe I don't fully understand the condition, the conditional recommendation, and also in terms of communication, like what is the plan for IPM to have these clear communications in terms of usage or percentage? Because we've seen governments or policymakers or people that are supposed to give this product to people use some key things to, let's say, be like, how can we're already having insufficient money to provide PrEP, then why are we bringing in the ring? Or if the ring is being compared to PrEP or something. So what are these clear communications that we as advocates can use to push our governments to be like, you know what, we really need this for this group of people or for people that want to use it, and also to kind of give women the right information for them to champion their own advocacy and be like, as a young woman in my village, this is what I need, such that it's not like it's Shakira speaking for everybody, but people are actually picking up this conversation and saying, this is what we want as young women. I had a conversation with sex workers, and by the end of the talk, everyone was asking me, where do we get this ring? And to be honest, I'm like, no, I'm just, giving you this information early enough for you to be prepared or to know about this tool, such that when it comes on the market, it is something that you can use. And they were all very eager to at least use it. Yeah, I don't know if it's a question or a statement.
Actually, Shakira, there was a lot in there. There was a call to action. There was the kind of advocacy we need. There was the importance of really making sure people have accurate access to information. But there was also a question of clarity for what exactly that conditionality is again. And I think it's really important for all of us to understand that. Michelle, can you help again?
Yeah, no, of course. No, of course. And Shakira, keep asking, please, because my job is not to confuse you. So, and if you don't understand it when I say it this time, ask me again. So first off, WHO recommends the Dapivirine ring, period. The conditionality is a bit of WHO lingo to just clarify that this recommendation is not, we can't recommend it to we do not know everything and all things about this product. We still have things to learn. We base this recommendation on 4 studies, 2 randomized control trials, 2 open label extension trials, and the values and preferences of women. But what we need is more information about this product. As far as WHO and countries are concerned, WHO recommends it, whether it's a strong recommendation or a condition. And the condition is really about, we need to learn more. And so that actually, I look at that as an opportunity to advocate for that more information, to advocate with your governments, to do pilot projects with younger women, to show that it works, to show women want it. I mean, this is one way of looking at it. But if that doesn't make sense, please ask me again, because I want you to understand it.
Maybe I can ask a question to help clarify. Sure. So some of the conditionality is that about the age group. This is not intended for women who are younger. Another conditionality is that,
wait, Manju, I'm jumping in here. We don't say anything about this product is not for younger women. There's no age. This recommendation and the language associated with this recommendation says nothing about this is not for younger women. This says we need more information about delivering this product and effectiveness of this product among younger women. I just want to clarify that.
That's really helpful. So when there is more information, like from the REACH study or from the pregnancy studies about the use, what does that mean to the WHO guidance? Does it change anything?
It might, it might not. What it will do is it will change our implementation advice. You know, if we have more evidence, stronger evidence, as we produce more documents and we're good at producing documents, the language will get stronger and stronger. And whether or not this recommendation is revisited, I can't predict that. And I don't want to promise that there will be a revisiting of this recommendation in 3 years. We might not need to revisit it. It might just come of its own accord. So does that help you, Manju? I think you're on mute.
Shakira, does that help? Does that clarify? She's nodding her head. Well, we are right at time, and I think that there was a fabulous discussion as well in the chat. We've gone a little bit over time, but it just shows how important this discussion is and continues to be. And of course, this is only one of many spaces that we are having this conversation, an opportunity to really get involved in making sure it is in your COP21, and you're working with other advocates to really think how you can, even in a country which is not a country which had a trial there, how you can really get it on the radar and speak to your policymakers, is getting involved in the COP21 process as well. And Emily put the link for the webinar in that as well. I will encourage you to send questions to us and engage with us and all the other advocates here. And there will definitely be more moments for us to have this discussion. Thank you so much for joining. And thank you, Michelle. Thank you, Sinazo. And thank you, Shakira.
Thanks for having us. This was great. This was really fun. Bye, everyone.
Bye, everyone.
Bye, everyone. That's for you, Emily. That's for you. Bye, Yanis.
Bye, Michelle. Bye, everyone.
Bye.